DIC, that is disseminated intravascular coagulation. Disseminated intravascular coagulation. So how does it actually occurs? So suppose there are many triggering factors for occurring this situation. One of them is like amniotic fluid embolism or severe trauma or endothelial injury. So the cellular matters or the platelet activating matters are exposed to the circulation. So these triggering factor can be like amniotic fluid embolism or premature separation of placenta. There are many like situation. The most common cause are like major surgery in the heart or lung. So endothelial injury occurs by somehow, and the procoagulant matters are secreted or released into the circulation, which then activates many platelets. So suppose there is a endothelial injury. So the endothelial things contain many procoagulant factors. So these procoagulants are released into the blood. So there is activation of coagulation pathway. So there is activation of coagulation pathway. So there is what coagulation does is that they activate the thrombin, which is a coagulation factor. So it is activated, and what does thrombin does is that it converts the fibrinogen into fibrin. So the thrombin does what is that it converts the fibrinogen into fibrin. So there is micro thrombi formation. We know what is thrombi is. Thrombis are sinusoid or solid masses which is produced from the blood components in the vascular system in the living body. So there is microthrombi formation, and these causes ischemia. That means the blood is unable to, suppose this is a vast vessel, so there is microthrombis formed. So the blood is clotted right here. The blood is clotted, so there is thrombi formed, and the blood cannot pass through here. So there is ischemia, right? So there is ischemia. So there is hypoxia, because the blood carries the oxygen, right? So there is hypoxia. There is organ failure. So as you can see, the procoagulant matters are released into the blood, so the coagulation pathway is activated, and from this, as the coagulation pathway is activated, the thrombin is also formed, and it what does, it converts the fibrinogen into fibrin, and these fibrin forms various microthrombi into the vessels, and the vessels get blocked, so the blood cannot pass, and so there is ischemia. So ischemia leads to hypoxia, and hypoxia leads to organ failure. And the another side is that because of these coagulation pathway, there is activated platelet, all the platelets and coagulation clotting factor, all the clotting factors and platelets are utilized, because they are busy to form these thrombis, right? So they are busy to form these thrombi, and these are decreased into the body, so they are already utilized. So, and there is excessive thrombi formation, right? So whenever there is bleeding, it cannot clot. So there is excessive bleeding. So suppose there is multiple thrombi formation. So there is like a negative feedback mechanism to stop these thrombi. So there is plasmin released because to stop this thrombi formation. So there is fibrinolysis. Plasmin causes fibrinolysis and they causes abnormal bleeding tendency. So what I've said is that there is microthrombi formation, and as there is really thrombi formation, all the platelets and clotting factors are utilized in this pathway. So whenever there is hemorrhage, the platelets are already utilized, so it cannot stop the bleeding. Another factor is there is already present many thrombus in the body, so the negative feedback mechanism, it causes the plasmin activation. So there is excessive plasmin and they causes fibrinolysis, that is the degrade the fibrins. So there is abnormal bleeding tendency. So there is a like imbalance between clotting and unclotting form